You okay? What's going on?
Man, my chest is hurting. I can't breathe.
Do I need to get you some help?
Yes.
159X, start me an ambulance for 159. He's having chest pains.
During your shift, you watch each other's back for all types of dangers. Well, that should include medical issues, such as chest pains as well. Fred Miller, a member of our Emergency Services Unit, will talk to you about chest pain and what immediate actions you can take that may possibly save your partner's life or yours. Please keep in mind that this information is solely for the use of another member of the SCSO, not with the general public.
Hello, I'm Sergeant Fred Miller, an emergency medical responder and instructor with the Shelby County Sheriff's Office Emergency Services since 2008. When we talk of chest pain, part of the difficulty in knowing what to do with chest pain is the multitude of reasons why they occur. Sometimes it's just an ordinary pain that'll eventually pass, or it could be the first sign of something much more serious. Sources of pain are gastrointestinal problems, like that burrito you had for lunch, muscle strains, illnesses like shingles, lung problems, even panic attacks. And of course, heart problems can cause chest pain too. Heart disease is the #1 killer in the US. One thing I want to mention right now is, when in doubt, get immediate medical help. I make numerous emergency medical calls which turn out to be nothing serious at all. Never feel bad that you called. We're talking about life and death here, so always err on the side of caution. If you or your partner experience chest pain along with any of the following, you must get immediate help. The officer has a history of heart problems. There is nausea and or vomiting. The officer has shortness of breath. Their skin is cool and wet, sometimes referred to as clammy. Their skin is pale or blue color around the lips. Their pain comes on suddenly with a feeling of pressure, tightness, or a crushing feeling. Pain spreads to their jaw, left arm, or back, and the pain continues for more than a few minutes. Simply won't go away, or goes away and comes back. It's important you don't drive yourself or have your partner drive you to the hospital. Calling for immediate medical help is considered the best and the safest thing to do. As soon as the EMS responders arrive, treatment can begin. So if you've called for medical help, what should you do now? Make your partner comfortable by helping him or her sit or lie down. Remember, they could go unconscious and suffering an injury by falling down. If in fact they do go unconscious, lay them on their left side in case they vomit. You must keep their airway clear so they can breathe. Make sure that the emergency medical responders can get to your partner. If it's a building, unlock or open any doors to make it easy for them to get inside. If worn, remove the ballistic vest. Don't eat or drink anything. Give the officer an aspirin tablet to chew on unless they advise that they're allergic to it or there's signs of a stroke. Strokes most often will be noticeable as a weakness on one side of the body, slurred or difficulty forming words. Have the officer speak to you, smile, hold both arms straight out with their eyes closed. If their speech is normal, their smile is even on both sides, and both arms come up to the same height, it's unlikely it's a stroke. Some additional information that will benefit EMS responders is knowing, when did the pain start? 20 minutes ago, an hour ago? What was happening just before the pain started? Eating lunch, taking a report, making an arrest? How strong is the pain, or how bad are you hurting? How would the pain be described? Throbbing, pulsing, steady? Is the pain spreading to other areas, the left arm, the jaw, the back? Does anything relieve the pain? Does laying down or sitting up help the pain? It also helps medical responders to know about any past medical history that would be pertinent, medications they're on, and when they were last taken, when they last had something to eat or drink, and note if there's an AED nearby in case it's needed. If you know CPR, follow the protocols you were taught. For most non-medical personnel, that will mean to monitor their breathing. If breathing stops, begin chest compressions. When the EMS people arrive, let them take over and briefly tell them what happened and what information you gathered. You never know when a medical emergency will strike. You knowing what to do can make a big difference. Thank you.
We all get slack when it comes to listening to our bodies. Usually, there'll be signs, but you'll need to pay attention to yourself and look out for one another. Be safe, and thank you for allowing us to be a part of your day.